So, I don't know how this is going to be structured and really how this video is going to come out, but I really wanted to talk about fears. Fears in medicine, fears of a doctor, fears of responsibility, the different fears that you're going to be going through. You may probably be going through some of these fears currently you're in medical school. You may be going through them when you are in working. You may be going through them, maybe probably even during your postgraduate training. So no one really actually talks about them very much, and it's something that is quite underrated because the responsibility that comes with medicine when you actually make the leap from preclinical sciences and you come now to looking at your clinical sciences, and then when you make the transition from that now to becoming a fully fledged doctor, no one really talks about the responsibility that you actually have on your hands and the fear that you have on your hands. I remember when I was in medical school, one of the biggest fears that I had is I'm going to have someone's life in my hands. I'm going to have someone's life as my responsibility. And I have to make sure that I do everything to actually save this patient. I do everything to keep this patient alive. What if I mess up? What if I do something that's going to kill this patient? What if I do something that results in this patient dying? Like, it got to me so bad that often I would find myself drifting, especially when I'm just sitting there. Maybe let's say I'm in a study session and I'm looking at something and my mind just drifts. So I'm going to be responsible for people's lives very soon. And you may not have these thoughts in medical school, but when you that period when you're waiting for results, or that period when you get your results, and then that period where you're waiting for employment, or if you're waiting to go and volunteer, you're waiting to go and start your practice, that point is where you tend to have most of these fears. Some people have them in medical school like I did. Some people have them during that transition point. Some people have them when they actually have started the process of internship or junior residency. Now, I used to always think to myself that, what if I don't know what's wrong with the patient? What if I give the wrong medication? What happens? If a complication comes, if a patient dies, how am I going to deal with that? How am I going to know that this is me that is messed up, and whatever is going on in this patient is probably my fault? How am I going to deal with that? And often you get to actually drown into all these fears, and once you drown in all these fears, you get to actually lose yourself sometimes. And it's very easy to actually lose track of the responsibilities that you're actually supposed to be having, because you carry a lot of this on your shoulders. And at the end of the day, remember this: you're not the only doctor that is responsible for that patient. Yes, you're going to be probably the first person that sees the patient, and most likely you're the one that's going to determine the general outlook of how this patient is going to be managed. Because sometimes the decisions that the seniors actually make are often based on your preliminary examination. So if you mess up real big time, even sometimes you may mislead the seniors. In some extent, or to some extent, you may actually mislead the seniors. And so that the fear of that is quite immense. And what actually keeps you studying, it keeps you reading, it keeps you on your toes, because you know that if you mess up on this, probably your patient is going to be mismanaged. Moreover, if you're in a place where it takes a bit of some time for your seniors to actually review your patients, then that's where now, if your patient dies in between that period, in between where you actually see the patient and then your senior reviews the patient and your patient actually dies, then that point is where it's a bit tricky, because you know when you mess up. Even in medicine, when you do something wrong for the patient, of course you won't say it out loud. No, will you go around telling everyone you've messed up? But in your heart, you will know that probably this is my fault. This is probably why I've messed up this particular thing. You may not be too courageous to admit it, Of course, we have litigation issues and all those things when those things come up to light. But if it's a mistake that you've made because of, there are mistakes in medicine that you can make that even experts could possibly make. That's understandable. For example, new procedures that have like maybe low success rates and high chance of mistakes. Yeah, those things that can happen. But then there are mistakes that you're not supposed to be making as a doctor. If you've gone through the training, there are mistakes that you're not supposed to be making. For example, this is just an example. It's happened before somewhere, but of course, for legal purposes, I'm not going to mention where, and I'm not going to mention who, and of course, for confidentiality and all these things. So there was a particular patient, a baby actually, a pediatric patient, that was supposed to, that came in, and this child had a fever. So one of the seniors said, no, let's give this child some IV paracetamol. And the senior left. So this person who was working on the shift, I don't know what they were thinking, they were new. So we have paracetamol IV. Yes, it is there. And we also have Calpol, which is just like an oral formulation, an oral type of paracetamol. So what does this person decide to do? They decide to get the Calpol. I don't even know how they managed, but they got it into a syringe, pushed it IV. And this is like a medication that is oral. A few minutes after the child went into respiratory distress, the child eventually died. And you know that this death is probably because of the Calpol that was given. So in that instance, when you are now the one who has committed that, how do you live with yourself? There are some mistakes that you're not supposed to make. And the fear of making those mistakes is sometimes quite overwhelming. I remember on my very first call day, I was seated in the call room, like visibly looking anxious. Even the registrar that was on call looked at me, I was like, you're new here. Then I was like, yeah, I'm new. I've seen you from somewhere, because I did my medical school at the same hospital where I did my junior residency. So that's why I was like, yeah, I've been here for quite some time. I've been at this hospital for quite some time. But yeah, I've started my junior residency. Then she was like, why do you look so nervous? Like, in my heart, it was my very first day, because I always end up in call days on like my first days. So in my heart, I was like, well, you don't know, but I told her that I'm just anxious because it's my first day. But in the back of my mind, what was going around is that, what am I going to expect? Am I going to know what to do when this patient comes? Am I going to know how to react? Am I going to know what to say? Am I going to know what to give the patient? Am I going to know if whatever I'm giving the patient is working or it's not? And the biggest fear that you have is, of course, messing up. Am I going to mess up on this patient? If I mess up, will this patient die? If they don't die and they go home, do they go home and die at home? Do they go home and survive? Those are some of the thoughts that constantly cross your mind. Even as a doctor, even as you graduate from being a medical student to being a doctor that's actually seeing the patients. And you never really know. Like, even the fear of your patients dying at home, you never really know, especially if your patients don't come back for review. I always assume that if my patients don't come back for review, they probably either got better or they got worse. You never really know, unless if you like have the phone number of the patient and you call them and ask them how exactly you're doing or what exactly is going on with you. But if they don't come back for review, you never really know if they got better. You never really know if they got worse. You never really know if they died, actually. So those are some of the fears that we often have in medicine. And having that background that I've given you, it's quite important for you to understand the different types of fears that you're going to have when you're getting into this career, the different types of fears that you're going to have before you get into this career, the different types of fears that you're going to have during your undergraduate training, the different types of fears that you're going to have during your postgraduate training. The first and most biggest, which I've already talked about, is pretty much the fear of having the responsibility of someone else on your shoulders. The fear of having someone's life in your hands. If you mess up, the patient dies. This fear never really leaves you. And yeah, the longer you are in medicine, the lesser some of these fears become. even in terms of having that responsibility, the longer you are in medicine, the less fearful you actually be in terms of this type of fear. So there is really no quick fix that I can say that, okay, do this, do that, it'll make you feel less anxious. There is no quick fix. But what I can say is that it usually comes with time. So the more patients that you actually see, the more you actually read, the more confidence your seniors have in you, even when they review your patients, make sure that you see that, okay, if my seniors come to review the patients, they've probably stuck with my diagnosis, they have stuck with my treatment plan, they've continued whatever I thought this was. Then that gives you a bit of some confidence, even when you're seeing similar patients like that. Subsequently, it will give you quite similar confidence because you know exactly what is going on and you know exactly that, okay, I did not miss this diagnosis, I did not miss how to manage this patient. It's a bit different where you're missing diagnosis and you're missing treatment. Like if the treatment is completely different from what you had actually started, then there should be a bit of some question there, because if maybe the senior did not intervene, could that patient be possibly still alive? It's a bit different because sometimes it's not always that the senior is right. There are some times where you actually are right. Even as a junior doctor, there are some times where you're actually right and you know it. Of course, there are some seniors that will come and admit that, oh, I think maybe you're right, especially if you reason with them. And then there are those that will never admit, but they know deep down in their heart that, okay, here I was wrong, the junior was probably right. There are some incidences, it's happened quite a number of times in my case in the different rotations that I've been, but I'm not going to be mentioning those, of course, for obvious reasons. So the second fear that most people have is the fear of not knowing. Like this one, trust me, you can't know everything. There is no master at everything. I remember back in that was fifth year exams, I got a heart failure patient, and by then we had exams that were rather physical. That was before this whole COVID thing. We had exams where we had what is known as long case, where you are given a patient, you sit down with the patient for about 40 to 45 minutes, you get your history, you write down your history or whatever, then the two examiners come in and they examine you. You present your case and they ask you questions. So I had made sure that before the exam, I go through the ward to see what patients we have on the ward. And lo and behold, they're distributing the cases to us. They give us a patient, and I'm seeing the patient, okay, legs are swollen, the bed is propped up. In my head, I'm like, this is a heart failure patient. What possibly could they ask me that I don't know about a heart failure patient? The exam was brutal. Like, they made me feel like I knew nothing about heart failure. They asked me questions that I have never heard of. They asked me investigations I have never heard of. And that was just like little me, fifth year me, trying to make it in medical school. So this fear of not knowing is always there. And remember that there will always be someone who's knowledgeable, more knowledgeable than you in every single aspect you can think about. And this fear of not knowing never really goes away. And that's what actually should keep you studying each and every single day, keep you studying, actually improving your knowledge base, improving the amount of information that you know. Because once you now get rid of that fear and you think that you know it all, you become a danger to the patients. It's that fear that actually keeps us reading constantly, keeps us updating our information. And once now you feel like as if you know every single thing and no one can tell you anything, you're the big boss, then that's what actually makes you a very dangerous doctor. So generally keep that fear with you. Of course, it gets better with time. The more patients you see, the more typical presentations, even atypical presentations of certain diseases that are showing up, the lesser that fear is actually going to be. And another fear that most people have, and this fear actually stems from medical school, is the fear of embarrassment and the expectations that you carry on your shoulders. Expectations from your friends in your class, expectations from your colleagues, expectations from your family, expectations from even the doctors that are teaching you. Even when you now graduate, more so when you graduate and you're now a practicing doctor, the expectations are even much, much higher. Like they don't expect you to make certain mistakes. They don't expect you to not know certain things. And sometimes this fear can keep you from learning. And I've always had this cross that I carry. And I know some of you will be able to relate with this. I think most of you that are watching this channel, most of you are medical students watching this channel, you should be able to relate to this information of expectations. You're coming from a home where everyone views you as a doctor. And generally in society, doctors are going to be viewed as quite knowledgeable people. And there's a way you're supposed to carry yourself. There's a way in which you're supposed to know certain things. And there's a way in which you're supposed to come out. Even when they ask you for medical advice on certain things, there are certain things that they expect you to know, like most things they expect you to know. And the unfortunate part is that if you don't know those things, they look down upon you. And sometimes you even get scared to answer certain things because you get scared to involve yourself because of those expectations. You don't want to disappoint those people. You don't want to be embarrassed, especially maybe like on a major word round. You know the answer, you're not so sure. You don't want to say anything, especially in school. Even as a junior resident medical officer, they ask you a question, you don't want to speak up because if you speak up, you'll be embarrassed in front of the students that you're with 90% of the time. Most of those students are also looking up to you, and you know that if you don't answer this question, they're probably going to talk. That intern, she was hiding behind the curtain. She disappeared during the major word round. There are those things, and they even give you names that one looks like he's suffering from academic anemia. They give you names. And yeah, but this is one thing that you must always tell yourself. When you got into medical school, did you get in with all those people? When you came to the hospital, were all those people there? When you're seeing patients, are you seeing patients with all those people? When you're ordering for certain things, are you ordering them with those certain people? When you're learning and you become a specialist, are you going to be learning with those people? No, you won't. You're doing all these things and you're making the journey alone, not making it with your mom or dad, not making it with your family, not making it with your friends. The journey is yours to take alone. So that fear, if you let it get to you, you hinder yourself from learning. You hinder yourself from making certain mistakes. And remember that in medicine, of course, we don't want to make mistakes because if we make mistakes, people die. And if we make mistakes, complications happen. But there are some times where those mistakes that you make will save countless number of lives. What do I mean? Let's say you're new in the system. You get a woman that has come in and she has, let's say, lower abdominal pain, a bit of some PV bleeding, but not out of the ordinary, positive Gravindex test. You calculate the dates based on her period and she's maybe like about 3 weeks. And you send her for a scan or something, and maybe the person who's, coincidentally, the way these things work, the person who's doing the scan also sends you back a scan that maybe this is an early pregnancy. In your mind, you're thinking, okay, this is suspicious, but you're like, but the scan didn't show anything out of the ordinary. You decide to send the patient home. A few days later, patient comes back with hypotension. They are in shock. They come in with massive PV bleeding, and they are brought in almost on the brink of death. Long story short, that patient is taken for theater and they are taken and you find out that it was a ruptured ectopic pregnancy, one that you missed. Now, the seniors will shout at you, obviously. You will look down upon yourself and you will feel this remorse. Of course, if you're human or if you do at all care, if you're studying medicine and you care, you will have this in your mind that I missed this and this patient would have died. I missed this. You have made a mistake, but your patient hasn't died. Worse off, if your patient dies, they do a postmortem and you find out that this was probably the case, then that's even worse. But if your patient hasn't died, like in this scenario, then you get shouted at. The next time you see such a patient who has a slightest suspicion of your ectopic pregnancy, you're going to make sure that you look for it. All the time, all the patients that you're going to get with PV bleeding, you look for it and you'll never miss it. And such that the people that you're going to see from now on, suppose if you see like, let's say 1,000 women, you'll be able to pick up all the ectopic pregnancies in those 1,000 women. It looks like the cyclone is about to come, all this thunder that's happening outside. So, long story short, your mistake that may have affected and impacted one person's life will end up saving a lot of other people's lives. So sometimes, now if you still have this fear of not allowing yourself to make these mistakes, you won't learn. So it's sometimes good to embrace these fears and to embrace whatever is happening and these expectations. And trust me, the expectations will always be there, especially from family members. They expect you to be top notch. They'll come with you with all these weird conditions. And maybe this is a topic for another day, or maybe this is like a research that someone can do. Why is it that family members and friends always come with the strangest conditions? Like, they never come with things that are straightforward. Like, complete strangers, they'll ask you straightforward things. Like, for example, oh, hey, I'm having this sharp chest pain and I'm having this fevers. You think it's pneumonia, and for sure it's pneumonia. But a family member or a relative or a friend will say, no, I'm having this chest pain. It starts off here. It moves to the epigastric region. It moves to the little toe. It comes back. It makes me feel like I want to vomit. And you have no idea exactly what you even talking about, and you have no idea exactly what's happening or what is wrong with this patient. Why is that so? Like, if anyone has an answer, please hit me up in the comment section below. So yeah, that's the other fear that you often have, the fear of not knowing. And generally, these fears will always be there. They're part of medicine. They help you get through. Just find a way that you're going to cope with these fears. One other fear that most introverts, like I think as an introvert, all those that are introverted and are watching this video, I think you'll be able to relate, because I am an introvert. I have fear of social interactions, fear of speaking to people, where if I'm sent to do a lab run, I'm sent to the radiology department, the mental exercise that I have to go through in my mind to actually talk to someone else is quite immense. And this fear of social anxiety, actually, it's a very hectic thing in medicine, especially if you're doing medicine, because medicine is a career where you have to talk to a lot of people. It's a talking career. Like, half of the time you're talking to people. And now if you have this social anxiety, you're not a social person. I know some of you will argue with me in the comments that how come you're not a social person? Do you know me? Are we together? Do we stay together? No. So my point is that, yes, I have this social anxiety. I'm socially awkward. I have trouble speaking to people. I have to go through these mental exercises. My social battery drains very quickly. So you may sometimes have some of these fears, and overcoming this social anxiety as an extrovert is quite difficult. But what I always tell myself when I'm doing something that is uncomfortable, I always say that this is growth. If I'm feeling comfortable doing something, then I'm not growing, then I'm not learning. The fact that this is making me feel uncomfortable, well, whatever. Let me just get it over and done with. I always imagine that the sooner this is done, the over it is, or the quicker it will be over, and the less I'll feel uncomfortable about it. And then I end up doing it and not even put much more effort to it. Yeah, so those are some of the fears that you may face. I'm sure there are more fears that I've left out, but those are some of the 3 common fears that most people have, and what I would like to call the fears of a doctor, which is what I'm going to call this video anyways. Yeah, so if you haven't subscribed to this channel, please subscribe. This is, of course, a podcast, unedited, raw content that I'm just like pretty much press record and just start talking. No script, nothing, unplanned. And I hope you guys are really loving this series. If you are loving it, don't forget to hit the subscribe button. Don't forget to hit the bell notification icon to never miss on such amazing content every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. See you in the next video. Bye-bye.